Assalamualaikum, I'm Ainaa, and today we'll be talking about something super important information, which is drug-food interaction, and my focus on Nsaid and also Ginkgo biloba. So let's dive in. To start, I will explain what a drug-food interaction is. Drug-food interaction is occur when a food, beverage, or supplement alters the effect of a drug in the body. These interactions are important in pharmacotherapy because they can reduce therapeutic effects, enhance toxicity, or cause unexpected side effects. Understanding this interaction is essential to ensure drug safety and efficacy, especially for patients on long-term or high-risk medication. Food and supplement can influence a drug pharmacokinetics, which includes the process of absorption, distribution, metabolism, and excretion, which affects drug pharmacokinetics by modifying the gastrointestinal environment, altering drug solubility and dissolution, influencing transporter and enzyme activities, changing plasma protein binding, and affecting elimination pathways. These effects depend on the drug's physicochemical properties, weight composition, especially fat content, timing of administration relative to food intake, and individual patient factors. Understanding this interaction is crucial for optimizing drug therapy and minimizing adverse effects. This slide discusses the potential interaction between non-steroidal anti-inflammatory drugs, or NSAIDs, and Ginkgo biloba, a popular herbal supplement. NSAIDs, such as ibuprofen and naproxen, are widely used for their anti-inflammatory, analgesic, and antibiotic effects. They work by inhibiting cyclooxygenase or COX enzyme, leading to decreased prostaglandin synthesis, and thus reducing inflammation and pain. Ginkgo biloba is a herbal product commonly taken to improve memory and cognitive function. It is also known to have antiplatelet properties by inhibiting platelet activating factor, or PAF, which may reduce platelet aggregation. Let's move on to the mechanism of interaction. Firstly, bleeding risk potentiation. Ginkgo biloba contains compounds that can inhibit platelet activating factor, or PAF, and affect platelet function, leading to an increased risk of bleeding. NSAIDs, like ibuprofen, also inhibit platelet aggregation by blocking cyclooxygenase enzyme, which reduces thromboxane A2 production. When combined, this effect can potentiate bleeding risk due to additive antiplatelet activity. Enzyme interaction. Ginkgo biloba contains ginkolite and flavonoids that can inhibit several cytochrome P4/5 enzyme, include CYP1A2, CYP2C9, CYP2C19, CYP2D6, and CYP3A4, and P-glycoprotein or PGP. These may theoretically affect drugs metabolism and transport. However, clinical study with flubiprofen, a CYP2C9 substrate NSAIDs, show that Ginkgo does not significantly affect this metabolism in vivo, meaning the real-life impact is minimal. Pharmacodynamic interaction. The main concern is pharmacodynamic, not pharmacokinetic. Ginkgo biloba's anti-platelet effects, when combined with NSAID's platelet inhibition, can increase bleeding rates without significantly changing the drug's absorption, metabolism, or elimination. Effects on pharmacokinetic (ADME). Firstly, absorption. Studies indicate that Ginkgo biloba at recommended doses does not significantly affect the absorption of NSAIDs or other drugs, as shown in clinical research where no significant change in drug plasma levels were observed. Secondly, distribution. No significant evidence suggests Ginkgo biloba alters the distribution of NSAIDs. Metabolism. Although Ginkgo components can inhibit CYP enzyme in vitro, clinical studies, for example, with flubiprofen, show no significant effect on CYP2C9 mediated metabolism in vivo. So, the metabolism of NSAIDs like ibuprofen is generally not affected at typical doses. Lastly, elimination. There is no strong evidence that Ginkgo biloba affects the elimination of NSAIDs. Next, potential risks. The primary clinical risk from the interaction between NSAIDs and Ginkgo biloba is an increased risk of bleeding. Both NSAID and Ginkgo biloba inhibit platelet function. NSAID by blocking cyclooxygenase enzyme, reducing thromboxane A2, and Ginkgo biloba by antagonizing platelet activating factor. This additive effect can lead to excessive bleeding, including serious events such as intracranial hemorrhage, gastrointestinal bleeding, or prolonged bleeding times. Adverse effects. Patient may experience bruising, nosebleed, ocular bleeding, or more severe hemorrhagic complication. The risk is especially high in patients with bleeding disorder or those who are also taking anticoagulant or antiplatelet drugs such as aspirin or clopidogrel. Therapeutic failures. Although the pharmacokinetic interaction such as absorption, metabolism, and elimination appear minimal, the increased bleeding risk may lead to the clinical complication. This might require the treatment to be stopped or adjusted, which could compromise pain and inflammation control. These are some case studies related to the interaction between ginkgo bilobas and NSAIDs. Firstly, intracranial hemorrhage. A 71-year-old man taking ibuprofen and ginkgo biloba experienced a fatal intracranial bleed. Secondly, spontaneous hypoma. A 70-year-old man on aspirin therapy developed a spontaneous hypoma, which is bleeding in the anterior chamber of the eye after taking ginkgo biloba. Patient counseling points for pharmacy personnel. First, dietary and supplement advice. Advise patient to avoid or use caution when combining ginkgo biloba supplements with NSAIDs such as ibuprofen due to the increased risk of bleeding. Patients should inform healthcare providers about all herbal supplements they are taking, including ginkgo biloba. Recommend avoiding other substances that may increase bleeding risk such as alcohol or other anticoagulant or antiplatelets unless supervised by a healthcare professional. Alternative drugs. Consider alternative analgesic or anti-inflammatory drugs with less effects on platelet function, such as acetaminophen, paracetamol, which does not significantly affect platelet aggregation and thus has a lower bleeding risk when combined with ginkgo biloba. Lastly, special precaution and monitoring. Monitor patient for signs or symptoms of bleeding, include unusual bruising, bleeding gums, blood in stool or urine, prolonged bleeding from cuts, or severe headache, possible intracranial bleeding. Advise patient to discontinue ginkgo biloba prior to surgical or dental procedures to reduce bleeding risks.